Hi, I'm Gaura Saini from the University of Minnesota, and today I'm going to be talking about implications of scapular or shoulder blade muscle timing for occupational health in overhead workers. Shoulder pain is really common in adults, especially people who are required to repetitively reach overhead or sustain an overhead position for their jobs. And one factor that might contribute to the development of shoulder pain is reduced upward rotation of the scapula, which is the motion that you can see the scapula doing in that video. This reduction in upward rotation may contribute to compression of the rotator cuff tendons, and when that's done repetitively, it may lead to degradation or tearing of those tendons. And there's two muscles in particular that produce upward rotation, and those are the serratus anterior and lower trapezius. And based on those muscles' actions, we expect that people with reduced upward rotation will present in at least two distinct movement pattern subgroups. One being an anterior tilt pattern where the bottom of the shoulder blade tips away from the rib cage, and the other being a lateralization pattern where the shoulder blade actually translates out to the side. And I'll show videos of those in just a moment. So the purpose of this study was to see if there are differences in timing of initiation of key muscles at the shoulder in those two reduced upward rotation movement pattern subgroups. And this will allow us to start to target interventions such that people can tolerate their work tasks and be resilient in their jobs. And we're looking at the two upward rotation muscles at the scapula, as well as the anterior deltoid, which is the primary mover of the humerus or the arm. In that top video, you can see an individual with the anterior tilt pattern where the bottom of the shoulder blade is kind of protruding away from the rib cage. And then in the bottom video, you can see a person with lateralization where the top part of their shoulder blade is sliding away from the spine. There were 42 adult participants in the study with shoulder pain, 20 of which were in the anterior tilt group and 22 were in the lateralization group. All participants performed an overhead reaching motion, and as they did that, their kinematics or their motion was assessed using an optical motion capture camera system, and their muscle activity was assessed using surface electromyography or EMG. All of the muscle activity is normalized to muscle activity recorded during maximum contractions, so it's depicted as a % of max. And I defined initiation of a muscle as when it exceeded 5% of its maximum contraction. Range of motion was also scaled so that for everyone, when their arm was at their side at rest, it was 0%, and when they reached their maximum overhead reaching position, that was 100%. For statistics, I ran a two-way ANOVA with factors of group and muscle. So on to results. There was no interaction of group and muscle, and the main effective group was not significant across all muscles. But across both groups, there was a significant difference in muscle where the serratus anterior was activating later than the anterior deltoid. And although the main effective group was not significant, I have presented the group data here in this graph where I have the two groups and the three muscles within each group on the x-axis and the % of range of motion at which the muscles initially activated on the y-axis. And there are some possible trends here that may become significant with additional participants. One is that the serratus anterior in red seems to engage or initiate later than the blue anterior deltoid in both groups. And over here in the lateralization group, the lower trapezius in yellow is activating later than the deltoid. So I had compared the scapular muscles to the anterior deltoid of the humerus, and in an ideal setting, we would see similar timing of the scapular and humeral muscles so that it's maintaining appropriate mechanics of the shoulder, including producing enough upward rotation to avoid compressing the rotator cuff tendons around that shoulder joint. So when I compared those scapular muscles to the anterior deltoid, I'm seeing that there's a delay in the serratus anterior activation in both groups and a possible delay in the lower trapezius activation in the lateralization group. When I compare my two symptomatic groups to a small cohort of asymptomatic control participants who have sufficient upward rotation, I see those same patterns. So I'm seeing a delay in the red serratus anterior in these two symptomatic groups compared to the control, and a possible delay in the lower trapezius of the lateralization group compared to the control. Overall, this is showing that there may be a benefit to training the serratus anterior and lower trapezius in people who have reduced upward rotation. And this information may be helpful for us to be able to target training to optimize biomechanics for the individual's job requirements based on the movement patterns that they're demonstrating. Thank you.